Hello viewers, welcome to my channel. If this is the first time you're clicking on my video, hi, I am Pushpen Dasgupta, an ENT specialist from India. I upload new videos on YouTube at 9 p.m. Indian Standard Time every day of the week. And each day follows a particular theme. Tuesday videos subscribe to the theme of MBBS ENT. MBBS ENT students have to deal with new types of questions now with the advent of new regulations introduced by National Medical Commission. What are the new questions? OSPI, OSCE and AIDCOM. I have discussed this in detail in a different video. I'll leave a link to it in the description below, where I have clearly stated that it is possible to get 100% correct in these new stations. So I believe it is a blessing in disguise. However, there are some challenges, especially in OSCE stations, that MBBS ENT students should be aware of. Now, a typical OSCE station assesses the ability of a medical student to perform a clinical test correctly. So, it will involve three individuals: the student or the examinee, the patient, and the examiner. So, the student has to perform a clinical test on the patient in front of the examiner within a stipulated period of time. It might be 5 minutes, it might be 3 minutes. The students will be made aware of what the time is before performing the test. Now, just performing the test is not enough. Of course, you have to perform the test correctly, but you also need to introduce yourself, explain to the patient what you're about to do in simple language, in simple words, without using medical jargon. And then you have to obtain verbal consent from the patient, and only then do you perform the test. After performing the test, it is very important that you tell the patient what you found out, what was the interpretation of the test. Again, when you are telling the patient the interpretation, you should speak in a language, in words that the patient understands. But you cannot lie to the patient. Don't give a false interpretation or an incorrect interpretation of the test, because for two reasons. One, it is unethical. You should not tell something wrong to the patient. And B, you are appearing in an exam where the examiner is observing each and every word that comes out of your mouth. So if you tell the patient something completely wrong, then you will not get marks for that particular action. Also, in OSCE, each action usually is marked. So right from introduction to thanking the patient, each action carries marks, and overall, if you perform all the tasks correctly, then there is no way that you can not get 100% out, 100%. Okay, so say if you are supposed to perform Weber's test, which is widely considered to be the easiest clinical test in ENT. If you perform all the tests, all the steps while performing Weber test, then you get 100% in that particular station. However, if you miss out on something, and people do miss out on some things, then you will not get 100% in that particular station. Maybe you will lose out on 1 mark or 0.5 marks, depending upon how well you have executed all the steps. So in this video, we will talk about how to perform Weber's test in the perfect way, and highlighting the common mistakes that MBBS ENT students make, so that when you encounter this in your OSCE part of the test, then you can get 100% if you encounter this Weber's test. So Weber's test was named after Ernst Heinrich Weber. Now, in an ideal world, you will not be required to know this. However, with the advent of OSPI, you might be shown a picture of this gentleman and be asked to identify not just the person, but also the test, this person's a test dedicated to this person, and then describe the test, and then write possible interpretation of the test. So this can be an OSPI question. OSPI are typically picture-based questions. Moving on, in Weber's test, you have to introduce yourself by telling the patient that yes, you are your name and that you are a medical student. Usually, you should introduce yourself as a medical student, because some examiners do not like you introducing yourself as an ENT specialist, because technically you aren't. However, I do have a rebuttal there. You are playing the role of a doctor, so might as well introduce yourself as a doctor. I don't see any harm in it, but some examiners do not like it. So introduce yourself as a medical student, confirm the identity of the patient, ask the patient's name, ask the patient's age, and then tell the patient that you are about to perform a test known as Weber's test. Of course, before before you begin communicating with the patient, you should know which language they are most comfortable with, and then communicate in that language if you also know that language. If that is not the case, then find a language that both of you can understand. So then tell the patient that you are about to perform a test known as Weber's test. In that test, you will take a device known as a tuning fork. I think it will be visible somewhere here. A tuning fork, you will make it vibrate by hitting it against a bony prominence on your bone. Now this is where students make mistakes. They do say that you will make the tuning fork vibrate by striking it against a bony prominence, and they mention the bony prominences correctly. Which ones are acceptable? Heel of the hand, olecranon process, lateral aspect of knee, and even rubber heel of the shoe is mentioned in the textbook. So these four are acceptable because it is there in the textbook. However, rubber heel of the shoe is strongly discouraged because in the real world you will never do it. You will never strike the tuning fork against your shoe and then place it on the body of the patient. That is never done, and it is there in the book. It is technically correct, but it is not practically possible. So let's just eliminate rubber heel of the shoe. So we are left with heel of the hand, olecranon process, and lateral aspect of knee. Now, knowing these three things is very good, but you also need to know where they are in the human body, and you have to strike the tuning fork against these specific locations. You can't say heel of the hand and then strike some other part of the hand. You can't say olecranon process and then strike some other part of the elbow. Okay, you can't say lateral aspect of knee and then strike the medial aspect of the knee or the thigh, something like that. That can't be done. That will not be acceptable. So be very careful regarding this. Once you've done this, so you explain to the patient that you will strike the tuning fork against a bony prominence on your own body, like the elbow or the hand or the knee, and then place the tuning fork's base, the foot plate of the tuning fork, on the forehead, in the middle of the forehead, or in the middle of the scalp, or you can also place it on the upper incisors. Okay, you will ask them to close their eyes or maybe even keep the eyes open. What they are supposed to tell you is which ear is hearing the tone louder, right ear or left ear. Okay, which ear is hearing the tone louder, which ear is hearing the vibrations louder. That's all they are supposed to answer. Then you ask, it will not be painful? You ask the patient, it will not be painful. Do I have your consent to perform this procedure? Patient will say yes, because patient also wants to participate in the test. They will never say no. So then you perform the test. You make the tuning fork vibrate. You place the base in the middle of the forehead, which is known as glabella, or the vertex, or the incisors. But it's very important here, again, a mistake that MBBS students make is they don't know where to hold the tuning fork while placing the base on the glabella. The base goes on the glabella, the tuning fork should be held at the stem. If you are holding the tuning fork at the prongs, then you are interfering with the vibrations. I have seen MBBS ENT students do this. Don't hold the tuning fork at the prongs while you're placing the foot plate on the forehead. Okay? So another important mistake that you should avoid. Once you've completed the test, if the patient says that I think I can't appreciate which ear is hearing the sound more, or the patient says maybe it is at the center itself, then what is the interpretation? The interpretation is of two types. There is the interpretation for the examiner and there is the interpretation for the patient. If the examiner asks you the interpretation, you say simply Weber not lateralized. That's it. You say Weber not lateralized. Usually in auscultations, examiners don't ask cross questions, but if they do ask anything, then you can explain further that Weber not lateralized means most likely patient has normal hearing. Now the most important words in that sentence is most likely, because you're only performing one tuning fork test, which is largely a screening test. You can't say for certain whether the patient's hearing is normal or not based on a single tuning fork test. So say most likely the hearing is normal. Hearing can be abnormal even when Weber is not lateralized. In which situation can hearing be abnormal even if Weber is not lateralized? If both ears have symmetrical hearing loss. If both ears have the same degree of hearing loss, in that event also Weber will not be lateralized. So if Weber is not lateralized, interpretation is most likely the hearing is normal. However, we need to perform a few more tests to know for certain what the hearing status is. That's how you tell the interpretation to the examiner. To the patient, you say that I have performed this test. This test suggests that in all likelihood your hearing in both ears is normal. However, I cannot say that for certain because I have only performed one test. I would need to perform a few more tests to get a better idea. Quite simple. This is how you approach Weber's test if you encounter it in the OSCE part of your exam, and if you do it this way, there is no way that you can't get 100% in this particular station. So please be wary of the common mistakes and please avoid them if you encounter Weber's test in your MBBS ENT exam. Take care. Bye bye. If you have any questions, if you have any doubts, please reach out to me in the comment section below. I'll be happy to reply. If you noticed any mistakes, then please point out and I'll be happy to learn from you. I hope I see you in the next video very soon, and please don't forget to be awesome.